the vaccine because you're patient facing and because of your, you want to protect your son.
Yes.
And of course, there's the larger issue of like, to get through this as a nation, we're going to all need to have immunity, where most of us, at least they estimate 70% of us, in order to kind of really get through this. And for me, as you all know, that I'm expecting, so I'm about 35 weeks along. I have been following, this issue of the COVID vaccine very closely, especially for pregnant women, or women who are trying to get pregnant. So for me, I was, really concerned about what's the safety profile for women like me. And I spoke to my OB about it, and I'm in agreement with her that those of us who are women who are healthcare workers, theoretically there's no risk to, based on how the vaccine was developed and the components of the vaccine, theoretically there's no risk to pregnant women, and that healthcare workers who are pregnant, because of the risk of COVID disease and the increased rates of ICU admissions and complications from COVID in pregnant women, because it is an compromised, immunosuppressed state, that they should take it. And also it depends on where you are in your pregnancy, because you need at least, 4 to 6 weeks to really build immunity completely. And then you have the 2 doses. So since I'm kind of in the latter half of my pregnancy, 35 weeks, hopefully it's going to be over soon. It's been okay, but you start to feel like an elephant. You're like, so I'm in the latter half. It'd probably take me a few weeks to get it anyway. And in addition to that, I'm not directly patient facing, as I am working remotely. So given all that's going on with the distribution and the shortages, I decided that it's probably best for me to defer until I actually go back into work, and that I am patient facing 100%, to kind of save those doses for people who really, really need them. As many healthcare workers still haven't had access to the vaccines. But theoretically, as for many of the clinical trials, pregnant women are not included in those trials, pregnant women and children, because they want to test the safety and efficacy of the vaccine on the general healthy population first. So we're often excluded. So we really don't have any data around whether it's safe for pregnant women to take it. But as I mentioned, when you kind of look at the science, when you look at the components of the vaccine, there theoretically should not be any increased risk for pregnant women to take this vaccine, right? In general, pregnant women should not take live vaccines like the measles, mumps, and rubella vaccine, the chickenpox vaccines as well. But other than that, typically, there are certain vaccines that are safe, that are actually recommended in pregnancy, which include the flu shot, and also in some cases tetanus, if you're not up to date, the tetanus, diphtheria, and pertussis. So yes, I mean, obviously we both kind of made our decisions based on our personal experience and our personal situations. And that's really kind of what we want to encourage people to do today, based on the information that we give you. Right, Jules?
Yeah. Informed choice. That's really the goal.
Yes.
Make an informed choice, and not a choice based on fear. That's what I tell my patients. It's ultimately up to you. No one is going to hold you down and jab it in your arm. You still have the ability to say, yes, I want the vaccine. No, I don't want the vaccine. The goal is really to make sure that you're making a decision based on the information that we currently have. And honestly, we don't have a whole lot of information about the vaccine, but we have almost 400,000 pieces of data about what happens if you get COVID.
As of now, and someone actually asked a question about information about breastfeeding moms and lactating women. So again, no data. However, there were several women in the trial who did become pregnant and have been followed. It's obviously a very small number, right? So we're just extrapolating data from just a few women, but who did become pregnant and who are currently being followed, and so far have not displayed any major complications from the COVID vaccine. I also spoke to my OB about it, and she is of the mindset that theoretically, if you're a healthcare worker, you get vaccinated. If you're pregnant and you get vaccinated during your pregnancy, those antibodies then would be passed to the baby, right, when you breastfeed. So it would actually be protective for the baby as well. I should mention, when you get the vaccine, the mRNA actually degrades very quickly within 24 to 48 hours. So after your body kind of makes, gets the cookbook recipe, the recipe is destroyed. So at that point, you don't have to kind of worry about, especially if you're lactating or breastfeeding or pregnant, like, is this thing going to pass to my kid? Or, it's, theoretically not possible.